My name is Arisha Tifel, and I'm going to be going over the United Health Group. The history begins in 1974 when Charter Men Incorporated is founded by a group of healthcare professionals, including physicians, and their main goal is to expand health coverage options for consumers. 3 years later, the company becomes United Healthcare Corporation, and by the end of the 1970s, a health plan for seniors is introduced. In the 1980s, the company is publicly traded, and they created Evercare to focus on nursing homes. Along with this, they created pharmacy benefits management, which actually becomes the modern PBM model. And by the end of the 1980s, a transplant network is created. In 1992, the report cards are produced to give information on healthcare access, quality, and care measures. The company also acquires Metro Health in 1995, and in 1996, AjudaPro AI is patented and awarded for the CIO Enterprise Value Award, and AI helps reduce time and cost for processing claims. The company also partners with AARP, and it becomes the United Healthcare Group, which is what it's known today. In the 2000s, web portals are launched, and the company acquires AmeriChoice. Consumer-driven health plans become the main focus in 2004, and in the later 2000s, the company merges with Pacificare Health Systems, and they acquire Sierra Health Services. And by the end of 2010, they adopt electronic health records. In 2011, UHG receives an Outstanding Corporate Innovator Award, and this award recognizes the business's results for new products and services. Later, they combine with Amil, and Amil is Brazil's largest healthcare company. And in 2015, Optum combines with Catamaran, and UHG launches a groundbreaking chemotherapy program. Optum is also a part of their business, which we'll go over later. In 2016, Optum partners with Quest Diagnostics and collaborates with CVS and Walgreens, and they later combine with Surgical Care Affiliates. And in 2018, Empresas Banmédica combines with UHG, which is in Chile, Colombia, and Peru. And now UHG ranks 6th in the Fortune 500 nationally and ranks 13 globally. The mission of the company is to help people live healthier lives and to help make the health system work better for everyone. Their main values are integrity, compassion, relationships, innovation, and performance. Their two main platforms are United Healthcare and Optum. However, they do have two foundations. One is United Healthcare Children's Foundation, which is medical assistance for families with help from generosity of employees and others. And they also have the United Health Foundation, which focuses on improving quality, cost, and access. United Healthcare is one of the platforms, and it focuses on health coverage and benefit services. Some of the insurance plans they offer is Medicare, individual and family, short-term, small business, dental, vision, Medicaid, and Medicaid. And they have member resources through programs and apps. Optum, it focuses on information and technology-enabled health services, which is the other platform United Health Group has. They have Optum Care, pharmacy services like Optum Rx. They have healthcare financial services through Optum Bank, and Optum also has business services and technology through data and analytics, healthcare operations, healthcare delivery, and population health management. The most interesting acquisition that UHG has made is Sierra Health Services in 2007. This includes the Southwest Medical Associates, which is Nevada's largest multi-specialty medical group practice. And I actually got the opportunity to meet with a bunch of directors in the Health Plan of Nevada, which is located in the UHG building in Las Vegas. They are definitely the most experienced health maintenance organization in Nevada. And I personally focus more on the case management aspect of Health Plan of Nevada. I noticed that they have been very hardly working on cost efficiency and quality care. And one of the main ways they're trying to do this is making sure that people know to use urgent cares more often and visit the ER less. Publicly, the company has invested $50 million to fight COVID-19, focusing on affected communities. They're also supplying meals for people in need. They've also pledged $5 million to support Americans experiencing homelessness and food insecurity, plus an additional $10 million to support communities worldwide. And in addition to this, they've also provided $5 million to support 10 partnerships in affected communities. And HPN and Southwest Medical Associates have actually turned their headquarters cafeteria into a meal prep base, providing over 10,500 meals a week for those in need, which is interesting because that's right in Vegas. Internally, employees are not required to take pay time off or leave of absence if they are diagnosed with COVID-19. The company is also providing backup childcare and reimbursements for rideshare or taxi expenses when they're scheduled to work and public transportation isn't available. Employees can also access virtual visits at no cost and request one early prescription refill. There are also new options for taking distributions from their 401k plans, and they are temporarily suspending loan repayments. Sanvello is an app also encouraged by the company for employees to use for stress, anxiety, and workout videos and things like that. The 403 tie-ins I found was that UHG recognizes the size and complexity of the U.S. healthcare system, and the company is looking into finding a modern, high-performing, and simpler system, actually. So this ties into the company understanding the main focus of AHA and insurance coverage, reimbursement methods, code sets, CDMs, KPIs, and revenue cycle are all topics that the company would have to understand completely. The main takeaway from this slide would be that each state has different programs, and UHG would have to comply to those, and along with that, understand different faculty and patient level adjustments and different payment systems, as well as they would understand measurement, transparency, and accountability. If I was CEO of the company, the future of the company for me would focus on research and development like they are now on chronic diseases like cancer, Alzheimer's, and continue to focus on lower cost, higher quality, and more access, and with a focus on affordable prescription drug costs. I would also want to expand more. Currently, they're in Asia, North America, Latin America, and Europe. However, they're not in all parts of these continents. I would continue to expand there in other cities, other countries, and I would try to outsource less by employing more specialists. The company already has some specialists like cardiologists and oncologists. So this would lead to a higher quality care because there will be more shared information between the team, and this would be kind of similar to the VA system on how information can be shared electronically nationwide. And I would think that the creation of an Optum hospital would help the future of the company. It would align with how the company wants to create a new healthcare system, and Optum already has its own primary care doctors. So it could be more streamlined for the company to be this way. Since the company is known for innovation and has won numerous awards for their progress and findings, I think research and development would be an important upkeep of the company to find even more better solutions for current problems, and then to streamline healthcare through Optum hospitals and employing their own specialists. Thank you for listening to my presentation.